As the country braces for the uncertainties of this holiday season, we want to turn back to that other big story of the day. Viewers are asking some very important questions about the vaccine. And so joining us now with some answers is Dr. Ashish Jha, the Dean of Brown University School of Public Health. Always appreciate you spending some time with us, Dr. Jha. And I want to get right to it. We're going to begin with a viewer question from Sarah. She's asking about the timeline for who gets the vaccine.
Would you consider teachers essential workers and some of the first to receive the vaccine?
So first of all, good morning, Robin. Thanks for having me on. I would consider teachers essential workers. So CDC just put out its recommendations, healthcare workers and nursing home residents and workers as the first group. After that, other essential workers. And I would definitely support the idea of teachers being in that next batch of people.
They certainly are essential. And parents are really realizing that now as they're having to do a lot of the teaching at home. If you've already had COVID, do you need to get the vaccine, Dr. Jha?
Yeah, right now the recommendation from the CDC, which I agree with, is that people who've been previously infected and recovered should get the vaccine. We think the immunity from the vaccine will last longer. If you've very recently recovered and you want to wait a little bit of time, I think that's fine if you've recovered within the last 90 days. But other than that, I do think people should get vaccinated either way.
All right, next up, Lisa, a viewer, has a video question about, this is a good one, about the vaccine trials.
Hi, I'm Lisa from Wisconsin, and my question for the experts is, have any people with pre-existing conditions or compromised immune systems been involved in the vaccine trials?
It's a great question, Lisa. The short answer is yes. Most trials are done with healthy people only. These trials are being done with people who are over 65, people with chronic diseases. They're included. We'll get more details on exactly who and how many in the upcoming weeks. But yes, they have been included in the trials.
That is encouraging for so many people to hear that, Dr. Jha. Another viewer question from Janet. She is asking about children and the vaccine.
I'm Janet Gardner from Katy, Texas. I wondered if you'll be getting the vaccine as soon as it's available, and will you also have your children get it as soon as it's available for them? When respected medical professionals start getting the vaccine, I think it'll instill a confidence in the rest of us. So I wondered what your thoughts were. Thanks.
Great question. I plan to get the vaccine as soon as I am eligible. I plan to show up on the first day that I am eligible and get vaccinated. I'm going to have my elderly parents get vaccinated when they're eligible. In terms of children, they have not yet been part of clinical trials. There are new trials starting up with kids. I'm going to both wait for some of that data for my children. I'm also going to be guided by the American Academy of Pediatrics. So we may end up waiting a little bit on kids, but as an adult, I will definitely get vaccinated when I can.
Interesting. This is a GMA viewer. Her name is Robin. Great name. She sent this question to us on Facebook. Robin asks, will you have to get the vaccine every year like the flu shot, or is it a one and done like mumps and measles? These are really great questions.
Yeah, that's a fabulous question. Not surprising that it's coming from a Robin. Look, we don't know a lot about the long-term immunity from this vaccine. I would be surprised if it's a one and done. I would not. My expectation is that you may need to get a booster. It may be annual. We just don't know right now. So we'll know more information in the upcoming months.
And the final question, Dr. Jha, from Twitter, will enough people take the vaccine for it to be effective in ending the pandemic? As surveys have shown that right now enough people won't take it to develop herd immunity.
Yeah, this is a really good question. Even if 30–40% of Americans get it, it'll make a really big difference. But we probably need to get to 70 or 80% of people getting vaccinated really to bring the pandemic to an end. So we're going to have to address people's concerns and hesitancy and really be, I think, work on helping people understand that this is going to be a vaccine that's going to be good for them and good for their communities.
Grateful to you and grateful to our viewers for those insightful questions and your responses. Thank you, Dr. Jha. You take care. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.